I'm joined by Seth Katz, the Vice President of Health Information Management and Revenue Cycle at University Health. Seth will be joining us at our upcoming patient access meeting taking place in July on a panel focused on patient estimates and the No Surprises Act. Seth, thanks so much for joining us today.
Happy to be here. Thank you for including me.
So to get started then, could you share with us a little bit about your professional background, how you got your start in healthcare, and maybe a little bit about your current role at University Health?
Yeah, happy to. I kind of stumbled my way in here. I always wanted to work in the healthcare field from a young age, but like many people, I was not a blood kind of person. So doctor, nurse, that kind of thing, not really in question for me. And when I was in high school, I read a book called And the Band Played On, which is about the history of the AIDS epidemic in America, and got me interested in public health and things like that. And so I went to school for health information management, and then I got my master's degree in public health. I've been with University Health, which is a safety net in Kansas City, almost 17 years now. Starting out in their file room, working my way up through the IT chain up to the associate CIO, and now vice president of revenue cycle, where I am responsible for the front, middle, and back end of both the professional and facility revenue cycle side. So pretty big group. When I came here, I didn't know if I would like working in a hospital or any of that, but obviously 17 years later, I love it. It has a great mission, taking care of people who have nowhere else to go. We're a very innovative and cutting edge hospital as well. And just, great teams to work with. It's a great mission, and just, very, very happy that I found my way here.
Well, it sounds like you were able to connect your early passion of helping others with your current work at University Health, helping others and kind of living that mission.
Absolutely. And, we do a lot here at University Health that, like I said, is a safety net. So that's a federal designation where we take care of people regardless of their ability to pay, who have nowhere else to go. We give them high quality care, treat them as human beings and all of that. And so absolutely, it combines a lot of my passions in one place. And the best thing about this job, I previously worked for an EMR vendor right out of school and then came here afterwards. But every day you get to see the impact you make, and you get to interact with patients. And I look at it from the rev cycle side as we want to make this the most seamless part of their care. If they're here for surgery, for a loved one who's sick, whatever the case might be, is we want to make their front, middle, and back end parts as seamless as possible, so they can focus on getting better or taking care of their loved one.
That's really great and so important. We're looking forward to having you on the panel speaking about collections, point of service collections, which is a tough topic and can be difficult to work with patients who are going through so much. Can you tell us one thing that you're doing working with your team to improve those tough point of service collections?
Yeah, it is hard. I think it's only getting harder now, right? There's a lot of financial uncertainty out there, inflation, possible recession, the government going to default. So absolutely, people are always very worried about that. And coming out of a pandemic where obviously there was high unemployment and things like that. So yeah, you have to, number one, always have compassion and put yourself in the person's shoes. We do try to collect, but we do not turn people away. We don't say, oh, you didn't pay your copay today, sorry, come back when you can. Number one is just having compassion. But the other thing too is really using technology to find a way to try to get where the patient is. So, being able to accept mobile pay, Apple, Google Pay, things like that. We will soon have the, check-in online apps where you can also upload your ID and pay your copay and all that maybe ahead of time. So finding ways to meet it where the patient doesn't have to necessarily walk in with cash, or they forgot a check, or they throw in their credit card through the machine, and whether that works or not, and tap and chip and all those things. So I think it's a lot of what we're trying to do is just find a way to connect people where they are and what makes them feel comfortable. And so again, using mobile options, which a lot of people do nowadays, and also pushing that a little farther up front, so you're not having that maybe awkward conversation about paying when the person's standing in front of you, when there's like 3 people behind them and they feel awkward if they say they don't have it with them today. That's kind of what we want to do. Again, keep it very compassionate and meet people where they are.
These are such great points. I mean, every single point is such an important aspect of meeting those patients, as you say, where they are. During the patient access meeting, we're covering an array of topics. So estimates, prior auth, a lot of different aspects that feed into those collections. Is there anything that you're looking forward to benchmarking with or to hearing from peers?
Yeah, I think there's a couple of things. I mean, the estimates and the good faith estimates for new surprise billing are a big deal. As a safety net, we probably do a lot. We have a lot more self-pay, so we probably do a lot more good faith estimates than some people. So it'd be good to hear how other people are managing it. We've largely done it manually. We don't have large budgets, so I can't go out and buy some piece of technology to do it for us. Um, but it's also been great because we're a nominal charge provider. We're low cost, and so um, being able to highlight that for patients is not a bad thing. But I'd love to hear more about how other hospitals are dealing with that. How are they pulling in all the resources, make sure they've covered everything? How are they having those conversations that can be difficult to say, hey, you need the surgery, but it's not covered by your insurance or just pay, and it's $10,000, $20,000, $40,000, and with whatever discounts, it might still be $28,000. And how are we going to make that work? So we'd love to hear more about that. And then absolutely prior also, just a number one topic for everywhere. Even CMS is getting involved in it. States are getting involved. It's getting pretty ridiculous. A payer the other day announced that they were going to start requiring pyrolysis for colonoscopies, because we all know people are just dying to get colonoscopies left and right whenever they can. So how hospitals manage through that, we've seen a dramatic increase in that, which is, we used to do about 2,100 a month or so a couple years ago. Now we're doing like 6,000 a month. So that has a direct impact on our patients who have to potentially delay their surgeries, delay their care, getting better because, hey, we're waiting on this payer who says they need 14 days to approve something. And, that's a big dissatisfier. And unfortunately, it's the hospital that gets dinged for it. So, we all can't hire enough staff to do these things. We have to work with payers better. And so sharing some of those best practices, how other hospitals have managed through that, while also managing patient expectations and keeping them informed about those time commitments that payers sometimes require that can be very lengthy. That's the kind of stuff I'm interested to hear, because we're all in the same boat. There's no secret sauce that anyone should be hoarding. We're all trying to take care of our patients, and so it's just about sharing those best practices.
Absolutely, and we're really looking forward to the meeting, and we appreciate you taking the time to share your perspective, and looking forward to having you on the program in July.
Can't wait. It's going to be a great time.
Thanks so much.